Hi guys, welcome back to Medical Coder Life. We're continuing our series on physician documentation, and today I want to introduce you to physician orders. Physician's orders are just that. It's their order telling staff, whether it's nursing, ward clerks, radiology, lab, whomever is assisting him with his patient care, exactly what he wants done. Okay? Physician's orders communicate the physician's plans for the patient by giving written or verbal orders or directions to the nursing staff and other practitioners. Orders are needed for any type of treatment or diagnostic procedure. And the way I look at it is when I go to my physician's office, because my physician office doesn't have a lab and a radiology department in the building, he sends an order with me. It's a written order stating exactly what he wants done as far as x-rays or lab work. And I take that order with me to the hospital. Because again, my physician's office is not at the hospital. So I take those orders with me to the hospital, to radiology or to lab, to get whatever radiology or lab services my physician wants rendered. Now, a lot of times they will email or scan them and send them right on order electronically versus putting the order in the patient's hand, or sometimes they do put them right in their hand. So again, these orders are written. They can be verbal. Again, he can walk up to a nurse and say, do da 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 da. But if that nurse is smart, she'll go to that patient's chart and write verbal order, physician ordered an x-ray, and flag it for that physician to sign off to cover her behind. Again, orders, there's this thing called standing orders. And the rule of thumb is, if a patient comes into your office and this is what's wrong with them, there's standing orders for admission to the hospital and what should be done, upon early admission. Well, standing orders are a set of routine orders used for patients with a particular diagnosis or to prepare for or follow up for a procedure. Again, these are standard. They're called standing orders. They're supposed to be done on everybody. This type of order is discouraged, particularly with managed care, because all of the actions may not be medically necessary for all patients, which is true. So that's why we're trying to get away from what's called standing orders. However, treatment guidelines and protocols that incorporate best practice, what's called best practice for treating particular problems, are being used. Orders based on these protocols provide a basic set of orders modified to address an individual's patient situation. So again, best practice orders are supposed to be the way to go over standing orders. Now in the past, I could understand a standing order. Physician didn't have to write out every single thing that needed to be done on a patient. He just had these orders that were pre-printed from a print shop on an order form and just said patient being admitted for, and he checked off everything he wanted done. And those were standing orders for admission. But again, not all patients have the same, even though their diagnoses might be coming in for a headache and everybody's got a headache, but he might want a CT scan done on one and not on another, and it doesn't make sense to run CT scans for a headache on everybody. So again, best practice orders are the way to go now. Okay? Orders initiate action. It is particularly important that all orders are dated and signed by the physician giving the order. So a lot of times when you have your ward secretaries or your ward clerks that are sitting at the nurse desk in the hospital, again, they tend to go through and they look to make sure that whenever a physician orders something, whether it's written or verbal, that one, it gets done, but first of all, make sure it's signed and dated. I even used to send my staff from my HIM or medical record department up to the floor to check off on these orders, because these orders have time limits on them depending on what they are, especially a verbal order. Joint Commission, JCAHO, requires the medical staff bylaws, rules, and regulations address verbal orders, and that such orders classified as being potentially hazardous to the patient be signed within 24 hours. So again, if your order has to be done signed within 24 hours, somebody needs to check on this to make sure that it is signed. Because when something's done, you don't want to go back and say, the doctor told me to do it and the doctor didn't sign off, and he'll go back and say, I didn't tell you to do it. So make sure those orders are signed and dated. I even required them to be timed to make sure we got them in that 24-hour period. Now, with the exception of office visits, now remember we're talking in our another series about different healthcare settings. With the exception of office visits, orders are needed for admission and discharge from facilities for treatments such as radiation therapy. So when a patient is even admitted to the hospital, there should be an admission order. When a patient is discharged from the hospital, there should be a discharge order. I look to make sure that last order does not say patient still lying in bed. It should say patient discharged home, because patient can't be discharged without a physician giving permission to discharge the patient. Therefore, there should be a discharge order. An admission order is written at the initiation of care, and a discharge order should be written on every patient when the physician determines that release is appropriate. The lack of a discharge order may indicate that the patient left against medical advice. Patient just got up and walked out. Now, if this situation occurs, the circumstances should be documented in the progress note and discharge summary. And y'all, that does happen. Patients will get up and leave. So if it does, cover yourself, because your insurance, your third-party payers, or other people involved in that patient's care is going to wonder, how did you allow that patient to leave or be discharged from the hospital when they're not finished rehabbing? Well, you can say patient left against medical advice, and you've got documentation to prove it. Okay? These physician's orders are frequently seen in acute care, ambulatory care, long-term care, home health care, hospice care, and mental health care. So again, these are physician orders, physician's directions telling the staff what to do to assist him, the physician, in caring for the patient. Okay, guys? That's it for now. See you in my next video.